Chattanooga police officers are changing the way they respond to people experiencing a mental health crisis. On average, they receive nearly 100 mental health crisis calls each week. Caroline Corrigan takes a look at this new program.
It's a critical problem across the Tennessee Valley, mental health care. For people facing a crisis in their lives, the care isn't always available. Lieutenant Tomisek with the Chattanooga Police Department says they respond to anywhere from 70 to 90 mental health crisis calls each week.
We're finding far more people who are suffering from mental health crisis. And so we are responding to more of those calls.
He says about 20% of officers are part of their crisis intervention team. But even with this training, it's not always enough. The Chattanooga Police Department has partnered with Volunteer Behavioral Health to have a social worker team up with one of these officers. As a team, they have started responding to calls of people experiencing a mental health crisis.
While our officers are very well trained and very compassionate, they are not specialized in that area. So to have a co-responder who does have a specialty and her area is working with mental health, people in crisis, that's just really makes it that much better.
Dr. Benjamin Miller says it's a move in the right direction. He's the president of Wellbeing Trust, a national foundation focused on mental and spiritual health.
It's really about transforming how we think about mental health crises in the city, in our state, in this nation, so that it's met with a much more appropriate response, one that could be therapeutic and helpful.
He says these changes can help ensure trauma and tragedy is avoided.
I think it's a very positive step for the city to start to see mental health as a priority. That I think for too long we've seen mental health as something that's on the back burner, something that we can address another day.
Many times officers will take these patients to a hospital for an evaluation. With this new program, the social worker can perform an evaluation immediately, which ensures the patient receives appropriate treatment as soon as possible. Reporting in Chattanooga, Caroline Corrigan, Local 3 News.
As of right now, there is only one social worker with the Chattanooga Police Department program. The goal is to eventually have 5 social workers available to respond to mental health crises.